Right. I want to be showing to you something. Still on the series on pregnant pigs and ensuring that you have the best from them. So, there's something I want to identify to you right here. So, there is one among these piglets that is showing signs of diarrhea. I noticed that this morning, and I want to bring it to you because we'll be injecting it right away. So, I want you to see so that you can also take note. One of the first signs we noticed was it wasn't feeding properly. This is it right here. It wasn't feeding properly, and this is it right here. It wasn't feeding properly, and we saw that. Now, if you can see, uh, well, they are done feeding, so most of the time they want to just go and rest. That's it right here. So that's it moving there. You can see the tail region. You can see that. So you have to be very careful when you have that's it right there. You can see it. That's it trying to struggle right there. It's not perfect, and we need to make it perfect. So what we'll be doing is we'll be injecting it with the all these guys. They are done feeding. So you can see after they are done feeding, all they want to do is to rest. So but it has not really fed because while the rest were feeding, I wished I okay. You can see it right here. You can see that right here. That is his work. That is his work. So we have to take care of it and ensure I believe you know the drug to administer is the sulfodimidine. So we have to give the mother is here. Look at the mother. So we have to give it the sulfodimidine. This is it. You can see. You should be able to notice what I'm saying. That's it. And you can see it from here. This is it. This is the result of that. So it's not perfect, so we cannot leave it that way, and that's why once you have these guys at this stage, you need to be very careful. You need to watch them very much to ensure that they are doing very well. You don't want to just leave them on their own. So once I came here and I saw that they were feeding, I saw that it wasn't able to feed the way it should. They were pushing it away and it wasn't very strong. So I knew already something was wrong. And just to confirm what I was saying, I saw it bring out this feces, this excreta. So then I knew that we need to take care of it. So I'll be giving it the sulfodimidine and the oxytetracycline, the early injection, then with the multivite. So that's what I'll be giving to it. And I may not show you the process of injecting it, but just to give you the update, these are some of the things you must do. The rest of them, if you saw, they are so active. They are done feeding now. That's why you can see how they are trying to sleep. The only thing on their mind now is to rest. They don't have time for any other thing. They just want to rest. They want me to leave them alone. But I'm coming not for all of them. I'm coming for this guy. This is the guy I'm coming for. You can see how feeble it is. So that's what I thought to show to you guys. Make sure when you have your animals, you are very sensitive. Be sensitive to their to what their excreta. Check their excreta, check their behaviors. Be sure that no one is weak. If you notice anything contrary, make sure you administer the right injection. To them. So that is what I thought to bring to you in this content, so that we can grow together and you can grow your farm and avoid any form of mishap coming on your farm. So you have to be very sensitive as a good farmer. Make sure you check on your animals regularly. Make sure they are active. Make sure they are feeding well. Make sure they are healthy. And at this point, they are not yet feeding on any external formulated food. So they are majorly feeding on their mother. So and this is not in some, maybe in 1 week time they'll be able to feed on. In 1 week time they'll be able to feed on the what's the name, the formulated feed. So we'll start feeding them in the next 1 week. In like some few days, not even up to 1 week, we'll start feeding them. So that will boost their growth and also ensure their growth is more rapid it would have been. All right, guys. Thank you, guys. We'll see you in the next video.